Hello, this is Dr. Lewerenz at Longevity Health Institute, and good evening. This is actually the end of my day, and some journals that I read often. I was reading this morning, and I wanted to review with you some things that are very interesting and stuff that we talked about here. I have other videos on and stuff on Facebook related to this, and I treat patients here every day with this, and my practitioners here at Longevity Health Institute. And we have wonderful success, but it's a complete model and a complete restoration of things that are related to your gut microbiome and gut health for immunity. And I just wanted to share some of this with you. So here's a review, New England Journal of Medicine. This is, I don't know if you can see this, but it says how the gut microbiome modulates the immune system in colon cancer, okay? And this is a review from two journals from 2016 and 2017. So not just last month, this is a few years ago, and published in Science and in New England Journal of Medicine. And it showed that the gut microbiome, meaning your gut flora, your gut health, hugely modulates and influences your immune system and immune therapy to colon cancer. Okay, now the stuff we see here all the time, I gotta tell you this, we see here all the time. When we build a good gut barrier, we control your T cells in your T1, Th2 immune response at the gut barrier. And that is 70 to 80% of your whole immune response in your body, okay? And this is what this study, and this was an animal study, and they plan on reproducing this in human trials. But this buildup of particularly this one microbiome bacteria called bifidobacterium, when they increased it fivefold, they saw an improvement in immune therapies in colon cancer and tumor regression. And I think what's important here in the take home, and something that was, very, very obvious to me, is we've been doing this and we've done this currently and for a few years, and even using more advanced therapies for gut health and leaky gut and the permeability issues related to gut and gut-brain access, including immune therapies, bacterial and building your microbiome, dietary changes, treating yeast and candida, okay, and optimizing your total immune response using LDN, low-dose naltrexone, and using particularly some polypeptides that are wonderful things that help colon cancer, all cancers, Crohn's disease, ulcerative colitis, and any type of inflammatory bowel condition. So this is just more evidence here, again, in the New England Journal of Medicine review, that, what functional medicine does and what we do here, but what functional medicine practitioners and personalized medical practitioners are seeing and have seen for years, and how it can help you and your loved ones. So, please, think about this, process this, share this with people that you know and love, because if you're suffering with a colon GI issue, and just in the last few weeks, we've seen and treated eosinophilic esophagitis, reflux almost daily, chronic heartburn, obviously the leaky gut issues that we see all the time, Crohn's, ulcerative colitis, and actually even complicated, been actually somebody that came to me from Canada that has been to a few different specialty centers in America because they've had multiple bowel resections due to, particularly early in their life, they had something called Meckler's diverticulum, and then they had infections, and they had scar tissue related to that, and something called adhesions that had to be taken down, and then they had I think 25, if I recall, inches of their small bowel removed, and they're left with chronic bowel functional issues and pain. And on follow-up with just a few simple steps, they've gotten probably a 30-40% improvement. Again, building the microbiome, building the gut barrier, working on diet and nutrition to be less inflammatory, and using peptides, particularly polypeptides like BPC 157 and ipamorelin to restore someone's gut lining. So this can be done, and it can be done effectively, and it can be done reproducibly, okay? But you have to be open-minded and see somebody like us, not just us, but somebody like us that practices functional medicine, regenerative medicine, looks at you as a whole, listens, very key, okay, and is your advocate, okay, and really uses some things that are out of the toolbox of necessarily the traditional cookbook, but things that are scientific, proven, and often more advanced. And I always say this, we're ahead of the curve. Often what we're doing here is helping people 3 to 5 years ahead of what becomes, publishable and normal, because it's basic, reproducible, personalized approaches to medicine that are functional and physiologic, okay? So yes, you can use words like holistic and regenerative and alternative, okay, or complementary, and those are all accurate and fine, but really what we're doing is personalized medicine and looking at root causes and details to help restore your well-being and function, okay? So there is hope, and this can influence you and improve your immune system and things that you suffer from, like bowel and digestive issues, chronically and sometimes very easily. In fact, actually, I have somebody that just came to mind that I saw last week, and they had told me, and not, no tongue-in-cheek and to sound funny or crass here, but they had not had a normal bowel movement or a regular routine bowel movement in years. And they thought it was related and tied to antibiotic use. They weren't sure. They've had a lot of stress, so there was probably some spastic bowel kind of issues and stress responses to the mucosal lining of the gut and irritable bowel type stuff. But anyway, they hadn't had a normal bowel movement. One visit, dietary changes, looking at their live blood to assess candida and leaky gut, putting them things that help naturally restore the gut lining, using the appropriate amount of magnesium, particularly glycinate and malate that you've heard me talk about before in videos, okay? And on their follow-up, and I believe I said probiotics, because probiotics are very key here, building the microbiome, the gut flora, and there's some I like to use, particularly I like to use one that I helped actually design called Biome Sec B. It actually has Saccharomyces boulardii in it, which is very good and specific for yeast and leaky gut. But anyway, long story short is on follow-up, second visit, okay, they were having daily AM bowel movements that they've never had in years, and they already had felt better, remarkably better. And not to sound funny, but if you poop, you feel good. Why? You're detoxifying, and you feel lighter, you're not bloated, etc. Okay? So hopefully this is educational and enlightening, okay? Share this with others. Follow me on YouTube here. Follow me on Facebook. Watch my video blogs and my Facebook blogs. And me and my practitioners, Alex, Lauren, Shannon, and my IV infusion nurses, Mary and Naomi, we have a wonderful practitioner team here that brings you the best in functional personalized medicine and bringing you high quality and quantity of life. So think about that, okay? Dr. Lewerenz, be well.